Good morning, child advocates. This is Nakia Outlaw. I hope everyone made it safe during this, weather that we are having. So it's 11:01, so we're just going to jump right in. We have Giovanni from Medicare Rights Center, and he will start his presentation.
Hi, everybody. I just want to echo what Nakia said. Thanks everybody here for braving the weather. I know the storm has passed, but it's definitely left a disastrous commute in its wake. And for the advocates who are joining us in the webinar, thank you. Today I'm going to be talking about Part B enrollment. Just as a quick recap, Medicare has two primary parts to it. Part A covers hospital insurance, and Part B covers medical insurance. But today we're going to be focusing on Part B enrollment because there's just a lot of confusion, unclear information about Part B enrollment. Part A enrollment, there's no confusion, so that's why we're not going to focus on Part A, because for the most part, and for the vast majority of Medicare beneficiaries, Part A is free. There is no monthly premium to be paid because for people who have worked at least 10 years, who have contributed to the Social Security tax system for at least 10 years, it's free for them. So there's not really much confusion surrounding Part A, but there is a lot of confusion around Part B because there's a lot of rules and regulations as to when somebody should be enrolled into Part B, when to delay Part B, the consequences of not enrolling in time or dire. So that's why we're going to be focusing on Part B enrollment. I'm contractually obligated to introduce my organization, the Medicare Rights Center. We're a national nonprofit consumer service organization. We work to ensure access to affordable health care for older adults and for people with disabilities through counseling advocacy, educational programs, and public policy initiatives. We are a specialist organization within the Child Network. We're here for you for any of your Medicare-related issues, any of your Medicare-related questions. Many of you have used our child professional helpline email, and I just implore you to keep using that in the future. So we're going to be learning four main things today. Part B enrollment basics, the Part B enrollment when it's combined with other insurances. So the question as to whether somebody should delay Part B enrollment or should take Part B when they are first Medicare eligible coincides with the answer as to what if Medicare is primary when they become Medicare eligible. If it's primary, then they should definitely enroll into Part B when they're first eligible. If it's secondary, then they have the option of delaying it. And the Medicare Coordination of Benefits rules, which pretty much designate when Part B is primary or when it's secondary, kind of illustrates when you should enroll into Part B. And we're going to be covering that in that portion. We're also talking about the Medicare Savings Program and Part B enrollment, one of the best strategies to enroll into Part B if somebody does not have Part B, and also equitable relief, which is another strategy of trying to get yourself into Part B. So again, why learn about Part B? The rules concerning Medicare enrollment are often unknown or misunderstood, and I guess for the most part, the government is at blame for why there's unclear information, why there's little information regarding Part B enrollment. There is a segment of the Medicare population that gets automatically enrolled into Medicare, into Part A, into Part B. We're going to be going over the scenarios where somebody's automatically enrolled into Medicare. So for those individuals, they don't have to worry much about enrolling or about missing the deadline because the government automatically enrolls them. But for a large chunk of the population, there is no automatic enrollment. And for this population, they really have little or no information as to when they should enroll. The government doesn't give them, Social Security Administration doesn't give them information or timely information about when they should enroll, if they should delay enrollment, or the consequences of not enrolling. All right, so let's just jump into the basics. So again, Part B is one of the primary parts of Medicare, and it covers medical insurance, doctor services, preventive care, such as mammograms, colonoscopies, BMEs or durable medical equipment, home health care, limited home health care, x-rays, lab, ambulance services, and therapy services such as physical, occupational, and speech therapy. And I just want to go over the cost associated with Part B in 2016. So the annual deductible for Part B is $166. So individuals, Medicare beneficiaries have to meet $166 deductible before the Part B coverage takes effect. The monthly premium, as you all may know, has shot up from last year's premium, which was $104.90. Effective January 1st, 2016, the new premium is $121.80. And this was, the reason behind this, as many of you probably know by now, is because there's a hold harmless provision that pretty much holds harmless 70% of the Medicare population from seeing an increase. So 70% of the population will stay at the $104.90 premium. And that's because Social Security did not award a cost of living adjustment, a COLA adjustment for the year 2016. So when there is no COLA increase and there is a Part B premium increase at the same year, the individuals who had been collecting Social Security prior to the increase, who had been having their Part B deducted from the Social Security benefits prior to the increase, are held harmless, because the reasoning is that there is no increase in their Social Security benefits to offset the increase in the Part B premium. So 70% will be held harmless. That means that 30% are pretty much footing the bill. This includes new Medicare enrollees, people who had not been collecting Social Security in 2015 but are going to start be collecting in 2016 and are going to be enrolled into Part B. Also includes people who are at a higher premium. Hold harmless provision does not hold individuals who are a little bit more affluent. Yeah, so that's pretty much why that increase is happening. And again, the Medicare Part B, the co-insurance is only 20%, so that means that Part B covers 80%, and the beneficiary is responsible for 20%. So these are just the different times to enroll into Part B, and this is the formal enrollment time. This is the formal enrollment period of enrolling into Part B. First, automatic enrollment. We're going to go into instances of how automatic enrollment works, the initial enrollment period, the special enrollment period, and the general enrollment period. Now, all these enrollment periods, individuals can enroll into Part A with all these enrollment periods. But again, we're going to be focusing on Part B, so that's besides the point. Okay, so automatic enrollment. As I mentioned before, there are instances where somebody's automatically enrolled into Medicare. And that means that the Social Security Administration will automatically enroll them into Part A and into Part B. And the three instances where this happens is if somebody has begun collecting Social Security benefits before they turn 65. Social Security will enroll them on their 65th birthday month. They're actually going to get their Medicare card, documents about enrolling, about an explanation of Medicare 3 months prior to their 65th birthday month by the Social Security Administration, by the Centers for Medicare and Medicaid, CMS. People who have been on Social Security disability insurance for 25 consecutive months will be automatically enrolled by Social Security on their 25th month. And much like the individuals who are aged into Medicare, they're going to get information packets and their Medicare card 3 months prior to their 25th month of getting SSDI. And then those who are receiving Social Security disability, who are under the age of 65, and they are disabled due to having ALS, they will automatically be enrolled into Medicare as soon as they hit all those criteria, SSDI and ALS diagnosis. There's no waiting period for them. Now, the initial enrollment period is pretty much the first formal enrollment period for individuals who have not been automatically enrolled into Medicare. And the initial enrollment period is pretty much a 7-month period surrounding a beneficiary's 65th birthday month. It begins 3 months prior to their 65th birthday month and ends 3 months after their 65th birthday month. They can enroll into Medicare at any time during the 7-month period. Now, it's always advisable for individuals to enroll into Medicare in the 3 months prior to their 65th birthday month instead of waiting for their 65th birthday month to come or waiting for the 3 months after. By doing this, by enrolling 3 months before the 65th birthday month, they're pretty much guaranteeing that their Medicare coverage will begin on the first of their 65th birthday month. And that's regardless if their 65th birthday month is on the last day of that month. It'll become effective the first of their 65th birthday month. Now, these individuals who have to enroll into the Medicare during their initial enrollment period, they're not going to get much anything. They're not going to get any kind of information from CMS, the Centers for Medicare and Medicaid, from Social pretty much left in the dark to try to like maneuver, when they should enroll, when their IEP begins, because they're not going to be sent any kind of information package from Social Security. And again, that is, the government is to blame on that because they're not doing a great job in informing these individuals, and that's why these individuals often, take Part A because, hey, it's free for them, but Part B, they're going to say to themselves, well, I don't want to pay under $21 a month, but they don't know the consequences of deciding that, of making that judgment, because they have no information, they don't have adequate information at that point. The Medicare Rights Center, we're actually involved in a lot of advocacy in trying to change that and trying to make Social Security and CMS provide them with, timely and adequate information. So there's just a breakdown of how an IEP would work. So again, let's say the Medicare beneficiary's 65th birthday is on August 15th of 2016. Their initial enrollment period begins 3 months prior to their 65th birthday month, so it begins May 1st of 2016. They can enroll starting May 1st, and it's advisable for them to enroll starting May 1st, because if they enroll in either May, June, or July, even if they enroll in the last day of July, their effective Medicare coverage or Part B coverage is August 1st, 2016, and that's regardless if their birthday is August 15th, August 31st. It's going to be August 1st effective date. Now, if they enroll after August, they're probably going to experience a gap in coverage, because if you enroll in September, your Medicare coverage won't begin until October. If you enroll in October, your Medicare coverage won't begin until November. So that's why it's always advisable for them to enroll prior to their 65th birthday month so that they don't experience any gaps in coverage. Okay, so now we're at the special enrollment period for Part B. If an individual has insurance from a current employer, that person qualifies for a special enrollment period. This is really one of the only ways that somebody can delay enrollment into Part B, and that's if they are currently working and they're actively insured by their group health plan. And current is the word is the key word here, because former employers or people who have retiree insurance, this special enrollment period does not apply to them. It's only for people who are actively working and actively insured. During this period, the individual can enroll into Part B without penalty, which means that they can enroll at any time into Part B as long as they're working and they're actively insured. So let's say somebody becomes 65, but they're still actively working and they're still actively insured by their group health plan, and they're actively insured and actively working until they reach age 70. They could delay enrollment until they reach age 70 because they're actively employed and they're actively insured. They can enroll into Part B at any time where those two things are good for them, while they're actively insured and while they're actively employed and actively insured. Or if they don't enroll during that time, they can enroll within 8 months of losing active employment or active employer insurance, whichever comes first. And I just want to point out that people who retire often select or choose to select COBRA insurance. People are also provided with a retiree insurance, and again, the special enrollment period only qualifies for people who are actively working, actively insured, not if you have retiree insurance or any kind of retiree health coverage. Now, the general enrollment period is the period that somebody should take and enroll into Part B if they've missed their initial enrollment period, and if they don't qualify for that special enrollment period. This is pretty much the only opportunity that they have to enroll into Part B formally if, again, they don't qualify for if they miss their IEP or they don't qualify for the SEP. The general enrollment period begins January 1st, so right now we're in the general enrollment period. It ends March 31st. The only thing is that when you enroll into Part B during the general enrollment period, I'm not sure why the logic of the rule, but when you enroll during the general enrollment period, Part B won't be effective until July 1st of that same year. So if somebody enrolls into Part B, didn't have Part B, didn't have adequate information to enroll into Part B, missed their initial enrollment period, did not qualify for the special enrollment period. He's told that the best opportunity for you to enroll into Part B is to take up the general enrollment period. So he waits for January 1st, they enroll into Part B through the Social Security Administration, that person will have to wait January, February, March, April, May, June, 6 months until they get Part B coverage, which, again, I don't understand the logic to that rule or regulation, but it is a Social Security federal regulation. Again, somebody who enrolls into the general enrollment period will obviously, have to contend with that huge gap in coverage, and also may even face Part B late enrollment penalties because they didn't enroll when they were first eligible to do so. So the Part B late enrollment penalty, it's 10% of Part B premium penalty for each 12-month period, for each full 12-month period. So a full 12 months has to go by that somebody didn't have Part B coverage when they should have. If it's 11 months, then the penalty won't apply. It has to be a full 12 months. That somebody delayed enrollment into Part B when they didn't have insurance through a current employer. That means that they didn't qualify for that special enrollment period where somebody has current employer insurance and is currently employed and therefore can delay enrollment. So people who don't qualify for that will be hit with a Part B penalty, which again is 10% of the Part B premium. So the Part B premium in 2016 being $121.80, 10% of that is about $12. So, and again, it's 10% of every 12-month period. So somebody goes 3 12-month periods, 3 years without Part B when they should have had a Part B, they're going to be hit with a 30% Part B penalty. And this Part B penalty will last for their lifetime, or for as long as they have Part B or keep Part B. It just sticks with them for their entire life. And they have to pay the Part B penalty on top of the base premium, which is $121. So somebody who has a 3-year penalty, which is 30% penalty, has to pay that on top of the $121 that they're already paying. The premium penalty is eliminated in one of two ways. One, if somebody becomes Medicare, if somebody's Medicare eligibility changes, so meaning that if somebody was Medicare eligible due to their disability or getting Social Security disability insurance for 24 consecutive months and they are under the age of 65, and then they are aged into Medicare, they become 65, their Medicare is kind of rebooted. They are in a new initial enrollment period because now they become Medicare eligible due to age. And one scenario that could play out like that is if, as I mentioned before, somebody who receives SSDI is automatically enrolled into Medicare. But they're also provided with the opportunity to delay enrollment. In the packet that they get from the Social Security Administration, they're going to have a letter explaining, you're going to be enrolled into Medicare, Part A, Part B. They're going to be explained, how Part B works, how you can delay enrollment if, you meet certain circumstances. Again, these individuals are provided with good information in a timely manner, unlike people who are not automatically enrolled. So people who are Medicare eligible due to disability, and let's say they're actively working, and they're actively insured, and they choose to delay Part B because, they have coverage through their employer. So they delay Part B, and then, they don't have Part B, but then their employer coverage terminates, and they forget to utilize that special enrollment period, which provides them with at least 8 months after their employer coverage terminates to enroll into Part B. They forget about that. They're on retiree insurance for 3 years, thinking that that's good enough for them, and they don't realize that they should have not delayed enrollment after their employer coverage terminated. So those individuals will be hit with a Part B late enrollment penalty, but when those individuals reach the age 65, they're going to be in a new initial enrollment period, which means that their Medicare gets rebooted, their penalty is eliminated, but again, a lot of people who are on SSDI and who have a Part B penalty, I was working with a beneficiary who was 37 years old, had a Part B late enrollment penalty, and you could wait until 65 to get that Part B enrollment penalty waived, but of course that's not a viable strategy for that individual. One of my favorite strategies of getting into Part B is through the Medicare Savings Program. It's an income-based program. It's state administered by the Medicaid office, and it can get somebody into Part B as soon as they're approved for the Medicare Savings Program. So they're approved for the Medicare Savings Program in October. They're going to get Part B effective October. So I guess this is just an explanation as to how the Part B premium penalty is calculated. Alfred, who turned 65 in 2010 and is not collecting Social Security, did not sign up for Part B until 2016. He did not have employer-sponsored group health plan coverage, allowing him to safely delay Part B. Because of this, his monthly Part B premium is now 60%. He went 6 years pretty much without Part B coverage when he should have. Higher for as long as he had Medicare. So 60 years times 10% is 60%. In 2016, the monthly Part B premium for those who are not protected by the home harmless provision is $121.80. So the Part B penalty calculation with premium penalty is $121.80 times 0.6 or 60% plus the $121.80 base premium. So Alfred's monthly Part B premium is $194.88. That includes the base premium of $121. So what to do when someone didn't enroll? When Medicare is primary and the person didn't enroll, they should definitely enroll into Part B as soon as possible. So the first thing that should be advised is that, well, you're in the general enrollment period. You should enroll right now during the general enrollment period. Of course, your Part B coverage will not become effective until July 1st, and you may face penalties. But at least that's the first formal way of enrolling into Part B if everything else fails. So that's the first thing that should definitely be pursued. It's always also advisable to check if that individual is actually eligible for the special enrollment period. Again, there's a lot of inadequate information out there. People don't even know that they are eligible for the Part B special enrollment period. They could say, oh, I retired 4 months ago, and my employment terminated 4 months ago. Well, that person is still within his 8-month special enrollment period. So, I mean, that's something that can definitely be pursued, and he can enroll into, or she can enroll into Part B by going to the Social Security office and utilizing that Part B special enrollment period. If not, you can enroll, again, Medicare for the general enrollment period. Anyone making decisions about Part B enrollment should always call Social Security Administration. Social Security Administration is the agency that administers Part A and Part B enrollment. So to enroll into Part B, you have to go through them. And it's always good to advise beneficiaries who are dealing with Social Security to keep logged note of people who we speak to, what was spoken about, the conversation that transpired, names of the representatives that they spoke to, because in that way they could utilize, if they were misinformed by a Social Security representative, they could utilize what's called equitable relief to get Part B, which we'll discuss, I think, in the next slide. So yeah, so equitable relief. Federal law that lets people request relief from the Social Security Administration in the form of immediate or retroactive Medicare enrollment and or elimination of the Part B premium penalty. You must show a failure to enroll was unintentional, inadvertent, or erroneous, and the result of error, misrepresentation, or inaction of a federal employee or any person authorized by the federal government to act on its behalf. Now, equitable relief, somebody can qualify for equitable relief or should have the right to request equitable relief only if they were misinformed by a federal agent. And it doesn't necessarily have to be a Social Security representative. More likely than not, it will be a Social Security representative because they're the agency that administers Part A and Part B enrollment, so they're the agency that beneficiaries will most likely be talking to when they are enrolling into Part B. But it could be any federal agent. It could be an agent from the Veterans Affairs Office. It could be an agent from the Centers for Medicare and Medicaid, CMS. Any federal agent that has provided misinformation that pretty much caused an individual to not enroll into Part B in a timely manner, and they now have to face dire consequences. So, as an example, let's say Medicare beneficiary maybe 1 month prior to the 65th birthday month goes to the Social Security office to enroll into Medicare, and they're doing the right thing. They're going to be 65 in the next month, so they're doing the right thing. They tell the Social Security representative, or their insurance, they say that they have COBRA coverage right now. COBRA coverage, again, being a sort of retiree insurance, which is coverage after their employment coverage, active employment coverage terminates. So they tell the Social Security rep they have COBRA coverage, and the Social Security rep tells them, well, you're covered. You don't have to enroll into Part B. You can delay Part B enrollment. Now, that's obviously erroneous misinformation. on the part of the Social Security representative. Based on this knowledge, the person decides, okay, well then I don't want Part B because I don't want to pay $121 a month, so I'll stick with my COBRA coverage. And they go on with COBRA for a year or two, and then they realize that they should have enrolled into Part B back then when they first went to enroll into Part B at the Social Security office. That person does definitely have the right to request equitable relief because they were misrepresented, they were misinformed and misguided by a federal agent who was supposed to be, giving them good information. So again, this is the portion that we will cover how Part B kind of works with other scenarios, with other coverage. And it kind of dictates, the coordination of benefits rules kind of dictate when Medicare Part B should be primary or when it should be secondary. And again, when Medicare Part B is primary, that's when a person should enroll on a timely manner, when they should utilize their initial enrollment period to enroll as soon as they can. Again, coordination of benefits is the order in which different types of health plans pay benefits. Generally, one insurer pays first on a claim, primary. The other pays second, which is secondary, covering some or all the costs left after the primary insurer pays. If the primary insurer denies a claim, the secondary insurer may cover it or it may not, depending on the plan rules and types of insurance involved. Now, again, COB, coordination of benefit rules, are very important when it comes to Part B enrollment because even if somebody is actively employed and is actively covered by their employer group health plan, they may not necessarily be eligible for that special enrollment period because it actually does, it's predicated on how big the employer is. And we'll go into that a little bit later. So current employer coverage. So somebody who is current, again, this is just reiterating what I've mentioned. Somebody who's currently employed and currently covered by the group health plan is eligible for that special enrollment period. But if we go on to the next slide, I'll show exactly when the special enrollment period will be in effect. Somebody who's 65 or older and currently working for an employer that is less than 20 employees, Medicare is actually primary for them. So that person should definitely enroll into Medicare during their initial enrollment period because their employer coverage is secondary to Medicare. Somebody who is Medicare eligible due to disability, but who is also currently working and covered by the group health plan, but that employer has less than 100 employees, for them, Medicare is primary. Those individuals should take Medicare when they're automatically enrolled by the Social Security Administration on the 25th month of receiving SSDI. They should definitely not decline Part B if they are given the opportunity to do so because Medicare for them is primary. These individuals do not qualify for the Part B special enrollment period. They need to take Medicare as soon as they become Medicare eligible. Otherwise, the consequences, as I mentioned, are large gaps in coverage, Part B late enrollment penalty. Now, somebody who is Medicare eligible due to disability is actively working and actively covered by the group health plan for an employer of 100 or more employees. The employer group health plan is primary to them. It's primary to Medicare. So those individuals will be allowed to delay enrollment into Part B because Medicare is secondary to them. Somebody who is Medicare eligible due to age, 65 plus, is currently employed and currently covered by their employer group health plan with an employer of 20 or more employees, the employer group health plan is primary to them, and Medicare is secondary. So these two scenarios is when people can delay enrollment into Part B. They qualify for the special enrollment period, which means that they can enroll into Part B at any time while they're actively employed and actively covered, or within 8 months of losing active employer coverage or employment, whichever comes first. Now, group health plans actually may choose to be primary regardless if federal law requires them to be primary. Federal law requires these employer coverages to be primary. Federal law does not require employer coverage for these individuals to be primary. But for those individuals, if the employer group health plan decides, to be primary, they can very well do so. But it's always advisable for the beneficiary to have that in writing to validate that. COBRA and retiree insurance. There's a lot of confusion out there between COBRA and retiree insurance and Part B enroll. And again, that has to do with a lack of adequate information on the part of Social Security and the part of Medicare. COBRA continuation of coverage is secondary to Medicare because COBRA is considered a retiree insurance. Any kind of retiree insurance will always be secondary to Medicare. So COBRA or any other type of retiree insurance is always secondary. Somebody has COBRA when they enroll in Medicare, the health insurance-related COBRA benefits usually end. If someone has COBRA and becomes Medicare eligible, it's not advisable to turn down Part B because Part B is actually primary to those individuals. Individuals will not be eligible for a special enrollment period, Part B special enrollment period, if they have COBRA coverage. And again, the same instance applies to people who have retiree insurance. Retiree insurance and COBRA are always secondary, so people who find themselves in that situation should definitely take up Part B as soon as they are eligible to do so. Medicaid can cover Medicare-excluded services like dental services and long-term. I don't have to talk much about Medicaid. You all know about Medicaid. But in the coordination of benefits rules with Medicare is Medicaid is always the payer of last resort. It is always secondary to Medicare. So somebody who has Medicaid, and that's the only insurance that they have, and they become Medicare eligible, they definitely have to take Part B and enroll into Part B because Medicaid is always secondary. So we're now into my favorite part of the presentation, the Medicare Savings Program. So the Medicare Savings Programs are Medicaid-administered programs that help pay Medicare costs for beneficiaries with limited income. At its core, the Medicare Savings Program is designed to pay the Part B premium. But a great bonus of the Medicare Savings Program is that it will actually enroll a person into Part B if they don't have Part B when they are applying for the Medicare Savings Program. Now, they must at least have Part A. If they don't have any part of Medicare, yes, hello? No, it will do it automatically as soon as they get approved for the Medicare Savings Program. Whatever effective date of that Medicare Savings Program, it will be the same effective date of their Part B. Yeah, they will get a new card as well. It also automatically, it not only enrolls people into Part B, if they don't have Part B, pays for the Part B premium, but it also automatically lowers their cost of prescription drugs through the enrollment into the low-income subsidy program, which is known as Extra Help. It's a federal prescription drug assistance program, and that somebody gets Extra Help as soon as they get Medicare Savings Program. And again, the Medicare Savings Programs are based on income limits. So there's income eligibility thresholds that people have to meet. And there are 3 levels of the Medicare Savings Program. The highest income level is QI, or a qualified individual. The middle income level is SLIMB, or the specified low-income Medicare beneficiary. And the lowest income level is the QIMBY, or qualified Medicare beneficiary. For QI, if somebody is approved for QI, the qualified individual, they would be provided with 3 months retroactive Part B coverage. But those 3 months of retroactive coverage can only be for the same calendar year. So if somebody was approved for QI in January of 2016, they won't get that retroactive coverage because they cannot dip back into a prior calendar year. Somebody who's eligible for SLIMB will also have that 3 months of retroactive coverage, but SLIMB can dip back to the previous calendar year. So somebody who is approved for SLIMB in January 2016, their Medicare Savings Program and their Part B coverage, the Part B reimbursements will be effective October? Yeah, October. October 2015, because it goes back 3 months. QIMBY, qualified Medicare beneficiary, is the lowest income level. It is also known as the most generous level of the Medicare Savings Program because not only does it pay for Part B, it is the only level that also pays for Part A premiums. And it's a good strategy to pursue for individuals who are not eligible for premium-free Part A. As I mentioned before at the beginning of the presentation, there's not a lot of confusion when it comes to Part A enrollment because for a vast majority of people, Part A is free for them. But there is still a small segment of the population that are not eligible for premium-free Part A, and Part A premiums are very, very, very costly. I think as of 2016, it's $411 a month. $411 a month. Just as a note, a person is not able to choose which MSP to apply for. Yeah.
When somebody applies for an MSP in order to enroll in Medicare, how quickly do you see that turnaround happening? Because I know it's automatic, but how fast do you see Social Security actually processing and putting on Medicare coverage?
Medicare coverage? I mean, first has to do with how fast HRA processes the application.
Because I know there's a lot of stuff.
Yeah, I mean, we've seen it for a couple of months. But I mean, the good thing is that it's retroactive to the month that it is approved for. So yeah, it can take a couple of months, but it goes back to when it's approved.
Thank you.
No problem. So here are the income eligibility limits for QI, highest income level, individual. The individual income cap is $1,345. For a couple, it's $1,813. SIMB is $1,197. Couple is $1,613. TWIMB is $1,001 for an individual, and a couple is $1,229. You may be asking why there is no asset limit. Well, there is no asset limit or asset count for the Medicare Savings Program in the state of New York, at least. And again, just to reiterate, what are the benefits of the MSPs? So all three MSPs pay for the Part B premium. It provides automatic enrollment in full extra help through a process called deeming. So somebody who is approved for the Medicare Savings Program will automatically be enrolled into the extra help program, which significantly lowers their prescription drug copays, helps pay for their Part D prescription drug premium. And again, this is through a process called deeming, which means that they don't actively have to apply for extra help application, for a standalone application. They'll just get it by way or by virtue of their MSP. It eliminates late enrollment penalties effectively. Somebody who has a late enrollment penalty and is approved for any level of the Medicare Savings Program, that penalty will be waived and void. It also enrolls applicants into Part B outside of formal enrollment periods, if they at least already have Part A.
Did they pay back the entire
To give the entire late enrollment penalty? That's a good question. I don't think so. I don't think so. They'll get reimbursed for the Part B premiums. Yeah, if somebody does for QI or SIMB, they'll get reimbursed for 3 months of the Part B premiums, but I don't think it includes the higher penalty that they were deducted. But I'll look into that and confirm. Yeah. And
keep going.
Oh, I'm sorry. Okay. I didn't know we were at the next slide. Okay, so enrolling in MSP will enroll a person to Part B. Again, this is just reiterating the main point. The applicant does not need to be in an enrollment period. The MSP is a year-round program, so anybody can enroll into an MSP at any month or at any time of the year. So they don't have to wait for those formal enrollment periods, for the general enrollment period. If a person has Part B late enrollment penalty, enrolling in an MSP will eliminate it, even if they lose the MSP in the future. So let's say somebody does have a Part B late enrollment penalty, they enroll into an MSP this year, 2016, they're approved for an MSP. When they're up for recertification, they lose that MSP because their income got higher for some reason. That penalty will be gone because of the initial MSP that they were enrolled in going forward. Now, if they lose Part B again for some reason, that's a whole other story. So this is a quick case study for you guys. So Mr. R is 68 years old and retired from his job at age 60 with retiree health insurance. He started collecting Social Security at age 65 and enrolled in Part A. He did not take Part B, thinking he was sufficiently covered under his retiree coverage. A representative of Social Security told him that this was fine. His retiree insurance is now refusing to pay on his claims since he is eligible for Medicare. How should you counsel Mr. R? Anybody? Yeah, great, fantastic. So definitely, this beneficiary was misinformed, misrepresented by a Social Security representative, by a federal agent. So he does have the right to request equitable relief. In addition to that, though, it's always advisable, again, to advise that beneficiary to take that formal enrollment period, which is the general enrollment period, and enroll into Part B, so that if everything else fails, if that equitable relief request fails, they'll at least be enrolled into Part B effective July 1st if they enroll during the general enrollment period. But yes, of course, equitable relief should definitely be pursued because this person was definitely misinformed by a federal government agent. And always, it's definitely good. If somebody says that they are missing Part B, always screen them for the Medicare savings program. Always. So, yeah, that was it.
We had a question over there.
Yeah. Any questions?
I can't see. So we have a question. If someone stopped working but the employer continues their work-based insurance, not retiree coverage, does the employer have a SEP when their coverage ends? So their employee have an SEP when the coverage ends?
No, because those two things have to be met. It's actively working and actively employed. So somebody who's not working does not meet those criteria. Could you hear me?
I think so.
Okay.
I don't know how to do this. There we go. Do we have any other questions?
I have a question.
Oh, okay.
Can I answer that? Yes. Oh, so we deal with a lot of immigrants, right? So, people could like us, work here, qualify for Part A, Part B, and they lost their job and 6 years, so they went back to China, lived there for 20 years, and come back. Are they also subject to the penalty if they don't qualify for MSP program?
They are, yeah. It's always advisable for individuals if they are leaving the country and they expect to return to not terminate their Part B. That's always advisable. Obviously, a lot of people are not going to take that advice because, well, I'm not going to be in the country for years. I don't want to pay Part B when I'm not going to be using Part B. So when they do return, they are going to be met with that Part B penalty.
Yeah, the case we have is not like a year. Sometimes they spend 8 months there, 4 months here. That's not a case. It's someone who went back for 20 years. When they come back, and then the penalty is like, whoa.
Yeah, that's 20%. So they're not eligible for the Medicare savings program. The general enrollment period is when they should enroll into Part B, but they will probably face that gap in coverage, and they'll probably get that 20% penalty, that 200% penalty because 20 years. Good God.
What if the person has secondary insurance and they call Social Security Administration and decline coverage? Like, does the Social Security tell them that it's not smart to decline coverage, they just decline coverage?
I think Social Security, the way they communicate about Part B enrollment is not great. If they were, usually speaking, ignorance of the law is not the best, argument. It's if somebody was specifically told them, a federal agent specifically told them, you're good to go. You don't need to enroll. And that's definitely a good way to pursue equitable relief. But just saying that, I just didn't realize it, even though it's understandable because Social Security does not do a good job, at least for people who are not automatically enrolled, to inform them in a timely manner. So it's understandable that people just don't know about the rules and regulations. Still is not a great argument to request equitable relief.
Within the MSP, they're going to renew every year, or they?
I'm sorry?
MSP, right? Are they going to renew every year?
The MSP is a yearly benefit, so they do have to recertify it every year.
What about if they forget to renew? Are they going to get the penalty?
Oh no. If they
Are they going to?
No. So as soon as they get the MSP once, initially, that penalty is going to go away. They're going to get Part B also if they didn't have Part B. If they lose the MSP, they'll still have Part B, but they have to make sure that they pay for Part B because they never lose it again. Because the MSP is what's paying for their Part B premium. So if they lose it, they have to pay for it.
We have a question.
All right.
Karen?
This is Karen, yes.
Yes.
Yep, this is Karen Stewart with Law New York. I am interested in learning about the process to request equitable relief.
Yeah, so again, equitable relief should definitely only be pursued if a beneficiary was misinformed directed by a federal agent. Usually that federal agent will be a Social Security representative because Social Security is the agency that administers enrollment into Part A and Part B. So more likely than not, somebody that goes to a Social Security office tells the Social Security representative, what their coverage history is, what their current coverage is, and the Social Security representative informs them that, since you have COBRA coverage, for instance, you don't need to enroll into Part B. Well, that's definitely misinformation because COBRA coverage is considered a retiree type of insurance. And retiree insurance is always secondary to Medicare. So somebody who has COBRA or any type of retiree should definitely enroll into Part B because Part B is primary for those individuals.
Thank you. I'm
going
to say thank you. I'm actually very clear on understanding the situations that would cause this. What I'm asking is, can you provide guidance on how you actually initiate a request for equitable relief?
We have, so the Medicare Rights Center, we have actually compiled a pretty nice guide process of how to request equitable relief, of where the citation in the POMS, the Social Security regulations, it cites that regulation of where, how and when to request equitable relief. So I could provide that to you if I guess you could provide your email.
I can send out an email to the network. That's fine?
Perfect.
Yeah. Okay.
So you'll send that information out to all of us?
Yes.
Perfect. Thank you so much.
No problem.
I actually have a client who's pretty much in this situation right now.
Oh, wow. Okay, so you could email our child network, or you could email me directly.
Yeah, you can email him directly because I may not be able to send it out today. So
and
go ahead.
I just want to I want to show you my email address. If you're ready with like a pen and paper.
I've got that stuff. Yeah.
Okay, so it's G like giraffe, F like Frank, L like Larry, O, R like Robert, E, Z like zebra.
I'm sorry, after the R, was that an E or a V?
E like elephant.
Thank you.
Z like zebra, at MedicareRights.org.
Thank you so much.
No problem.
Thanks, Karen. Do we have any more questions?
Do you recommend an individual who is Medicaid eligible to simultaneously submit an MSP application? I understand that HRA is supposed to screen that person, but I have seen that not happen multiple times.
We've seen that.
And if so, where do I send the MSP application in the same envelope to HRA? Do I send it separately to a Medicare Rights Center? What do you
can send that out. Yeah, I mean, yes, definitely there is guidance. There's policy that dictates that the Medicaid office should screen somebody who is for an MSP who's eligible for DAB and Medicaid. That doesn't happen very often, not often at all. So you can submit a separate MSP application to us, and we will be definitely glad to review it. Submit it to HRA directly. We do it twice a month. We submit it. We go directly to their office, submit it to them, and then we can track those MSPs.
That'd be helpful. But I've also seen some clients who have been told they've applied for an MSP twice at two different locations, which then completely derails their approval. So if I were to send it separately to a Medicare Rights Center, I'm concerned that they would be told that they applied twice.
Well, at least, I mean, the good thing about sending it to us is that we have a really good relationship with HRA. And if we submit it on somebody's behalf, we definitely have the authority to follow up, to request correction, to request any kind of, any kind of errors to be righted.
Okay. All right.
And depending on the circumstances, if somebody really was meant to be assessed and wasn't, and they were fully eligible for QMB, because the things that are higher, if you choose to get spend on or not, and that's a situation where somebody might not get automatically put in, but you could potentially argue that they should actually have it put up in the past.
Because I actually have a case going on with you for one of my clients through Make the Road, so I will email you. Follow up and see if you can double check that.
Okay, definitely. I mean, like I said, sometimes when we submit MSPs to HRA, it does take HRA 45 days to process an MSP. Sometimes it goes a little bit over that. So we're definitely diligent, always following up.
Yes, you are really helpful.
Thanks. So just shoot me an email.
Okay.
I have a question. If a couple
What is considered a couple? Because I have clients who are married, but they're separated.
A couple is somebody who's married and living in the same household. So if they're separated, they'll be budgeted as an individual. Well, separated and living in, like, if they're separated and they're living, you know.
Definitely have those.
Yeah.
You have those, they're separated.
Yeah. Yes, ma'am?
I sent to an SE to enroll in SE as well, and then the SE in the system would say that you can't enroll your MSP. This would have been sort of like when the application.
Right.
Yeah, I don't know what they could have never submitted an application.
I mean, the only scenario where somebody is not eligible for Medicaid if somebody has an MSP is if they have that MSP at the QI level. Because you can have, yeah. So that could definitely be. And you submitted it to us?
I emailed.
Okay, I'll follow up with Andrea and look into that because I just thought it could be some kind of error on HRA's part.
Or even though yes.
Oh, on the FE part, yeah. The Medicaid? You could definitely advocate for it. I wouldn't be, yeah.
Did you get a denial, or did you just get told by the FDA that it?
And then I get what you are.
Yeah.
But they do have Quimby, right?
Yeah.
Okay. I mean, the good thing about Quimby is that it kind of, I mean, it's not definitely Medicaid, but it works like Medicaid. I see. Well, it's good. If somebody is Quimby, I mean, you could tell them that they are protected by the, the Quimby balance billing law. So nobody can balance bill them. I'm sorry? I could give you like a whole packet of that.
And we showed up. Another navigator looked at the application and they wanted to do it. But when we called to have a new one sent, we sent them an access form. They didn't send them an access to your form. So I looked at the whole thing and I was like, I referred him to a medical specialist because I didn't want to mess it up because it was nowhere near the same questions that they were asking him on the MSP. So I just thought that was
that's strange. Why would they be sent an access form?
I don't know.
I'm not even sure what access form is.
Yeah, I've seen eligibility workers at HRA offices give people a Medicaid application and they only wanted an MSP, and then it's a huge pain in the ass for Medicaid. Yeah. It's a whole thing. Yeah, so I've seen that happen. It's not supposed to happen. There is a separate form that's just MSP, but I think that it appears the city agency at large doesn't always know. But if you know for your client, you can just give them the MSP.
Yeah. Because what we just did was I was like, let's send you to a management specialist. They would be better off,
Again, you can send any of these issues to me, to the Medicare and GHPs. Again, we're here as a specialist organization for you guys, so please use us.
And this is where we should send case referrals, right here?
Yeah.
Great.
Yeah.
Alright.
I'll be prepared.
Okay.
Any other questions?
Any other questions? All right. So I want to thank everyone for joining us today. The recording will be up and running hopefully by this week. So if you missed the training, you can watch it on a child portal, as well as just a reminder that we have a database part 2 training this Thursday. I ask that if you can to please attend. That training will also be recorded, so you can watch it if you are unable to attend that webinar. But if you can, please try to attend on Thursday. Thank you, and Have a blessed day.
Thank you.